Welcome to the Resilient Butterfly Podcast. My goal is to share inspiring stories of healing and recovery through many diverse approaches and models. Our guests bring incredible lived experiences, insights, and/or professional expertise, each with their own unique path. While we highlight and celebrate these stories, our intention is to inform, inspire, and demonstrate resilience and creativity. This podcast does not endorse any one approach. We believe there is more than one way to heal, and we're here to showcase the resilience and possibilities that exist. Hello, everyone. Welcome back to Resilient Butterfly. I'm your host, Pam Feinberg-Rifkin. The podcast is to explore recovery, resilience, and strength it takes to heal and grow at every stage of life. Today's episode is especially close to my heart as we explore with a pediatrician ages 0 to 18. And Dr. Celina Moore is extremely excited to be here.
Yes.
Because of the behavioral health and substance use disorder that we can talk about. And you say 0 to 18, why? There unfortunately are many, many things that are happening now in this world. And a couple of those things are our mental health, behavioral health issues. And I'm really excited to have Dr. Moore here to talk about all of these and many more things that potentially will come through. So welcome.
Thank you. I'm so excited to be here.
So I'm really curious, first of all, as a pediatrician, this is generally out of your scope. And anytime I have had my children as wee people, young, I take them to the pediatrician, and nothing's ever discussed about their emotional state or as in going into teens, any questions about any alcohol or drug use. So what led you into your interest in behavioral health, and what is your background in that regard?
Well, to address the first thing that you mentioned, it is our duty to look at the entire health of the child. So it's not just the physical health, but the mental health, emotional health, all of that. A lot of those questions might not be asked in front of a parent. So your child may have been adequately screened and you were just not aware. Sometimes I ask questions with my back to the parent. And as I'm performing, for example, an abdominal exam, I just, screen the child by whispers. But usually what we do is we have a written questionnaire that the child fills out. And then when we ask the parent of the older child to leave the room, when we talk about more sensitive issues, to give that child the privacy and the autonomy to be able to discuss more sensitive issues that they might not want to discuss in front of a parent. So pediatricians, we're supposed to be doing this. And I think my interest accelerated rapidly after the Parkland shooting, where my practice in West Boca Raton was very influenced by all of the children that were affected. The children who went to that school, the children who went to neighboring schools, the children that knew children that were at that school. And so I took it upon myself to look, to study more, to take more, continuing medical education courses in mental health, in pediatric psychiatry, so that as the front line, I would be able to start treatment, to give sound recommendations as the waiting list for trained mental health providers was getting longer and longer at that time.
That's really interesting. I want to note here, and this is going to be aired a few months later, but my granddaughter was in the synagogue in West Bloomfield, Michigan, in the preschool last week. And that community is railing, as well as us that also have been affected by that. So timing is just everything. And of course, with COVID too, everything changed for children during that period of time. And we talk about COVID babies or COVID children that didn't get to school. So
Right.
I'm sure that there was a lot that you saw during that period of time and still do
And
as
still
after,
do. Yep.
after
The
effects.
ramifications are still going on. Yeah.
Unfortunately, those ramifications go on, and there are a lot of healing. There's a lot of healing to be done, and to have parents know what is available for their children, and that they're not weak because they need. The family is not weak
Absolutely.
because they need resources to get through those times.
Absolutely. And again, as we mentioned earlier, your general pediatrician is your front line, is your number one advocate for the health of the child. So that's always a great place to start when you're dealing with any type of crisis, whether it's a crisis happening in your community, or if it's happening in your home, or if it's happening inside of you. Always look for your pediatrician. We're always there to help.
So when someone comes into your office, you get to know them as infants or as they come in, right? What is your assessment? How early does your assessment start? Does it start with the family first to find out really what's going on in the family?
Absolutely. I always do. Always offer prenatal consultations to be able to get a sense of the family, what their goals are, what their fears are, and, to talk about all things children. And as a pediatrician, I have this very unique position where I'm almost part of the family, right? I get, called into the dinner table if you don't eat your peas, or, if you don't do this, I'll call, your pediatrician, or they quote me, or children pretend to be, their pediatricians. So we have a pretty big presence in families, which is an honor. And making sure that, you take a good family history, not just of cancer risk or allergy risk, but also of mental health and addiction risk, because all of that is going to form the child.
Sure. So I don't recall, because my children are 34 and I'm near 40. I don't recall actually doing a family history when I went to the pediatrician many years ago. So what does that assessment or family history look like? First of all, medical for sure. I probably did, but I don't recall having any mental health history that they were asking about. Can you describe what that would be?
Yes, we usually ask questions about first-degree relatives, parents, siblings, and then a little bit further out to grandparents, aunts, uncles, cousins, and ask about, in terms of mental health, has anyone ever been hospitalized for a mental health issue? Is anybody being treated for a mental health issue pharmaceutically? Is there any history of addiction, and what does that look like? And then we always take a suicide history to see if there's been any suicide in the family.
Got it. And with that, then that's a known, something to be able to have at least know and to watch as the children progress through their years, correct?
Right. And, women who are becoming mothers right now are, I love these generations that are coming in after me. I mean, I think they're amazing. I think that they are so much more open about mental health than my generation or the generation before me, where it was more taboo. And so a lot of times it's offered to me as, I struggle with anxiety. How do I know if my child's going to struggle with anxiety? So it's already like on the forefront of their mind when we're going through a family history that's offered to me before I even ask about it.
Sure. And I know that for years now, ADHD has been one of the biggest, I think, identifiers potentially in school-age children.
Yes.
How do you assess if someone is ADHD, or what are some of the tools that the family can have to help the child versus going on any medication?
That is such a complex question. And I think we can use the same thing, like the same structure when we talk about autism spectrum disorder or anxiety-related disorders, when usually the tipping point will be if the attention deficit disorder or the learning disability or the anxiety, for example, is impacting negatively more than one function in their life, right? Whether it's impairing them from being a successful student, if it's impairing home life, if it's impairing for older children, maybe sports or after school activities. And if it's impairing more than one realm of life, then we come in and we take a look at it. The other thing that I think needs to be noted is that a lot of these issues are coming up a little bit more prevalently right now because of the way that traditional schools are structured, where a child is expected at a very young age to kind of just be, sitting and paying attention and completing tasks. And children are meant to move, and they're meant to play, and they're meant to, release all this energy. And over the decades, we've seen a shift of free play, during recess or during times of the day, to a removal of these more creative forms of learning, whether it's learning how to negotiate conflict on the playground, or learning instruments in a music class, or learning how to follow contours and lines in an art class, and accessing different aspects of the brain. That school has become more of these different pockets of education of, you have to learn these metrics in math before you can move on to the next level. You have to understand how to, reading comprehension before you move on to the next level. And children are expected to respond in ways that previous generations didn't have to. And, as a pediatrician, I can look, step back and take a look at all of these things that are negatively impacting kids. And there's not much I can do about it, but you can see it. You can really see that children who are acting out in class because they don't have the ability to regulate, because their brain hasn't developed that way yet, are being punished by the removal of the things that would help them. Recess, right? So the child says, sorry, little Johnny, you've been jumping out of your seat all day. Now you have to sit here while everyone else goes and plays. And that one thing that would have helped, little Johnny for his afternoon sessions now put him backwards even farther. And, I don't want to say I can't fix that, but it's.
Is there any way to have, I know, this happens in all the schools across the country, I don't know about other countries, but for sure in the U.S., because of the metrics, as you say, that have to be met, and the teachers are under the gun to make sure those metrics are being made. But is there any way to have education in the school systems to provide avenues, such as, some schools across the country have implemented yoga or meditation for children? Is there a way to do this in Palm Beach County, where we live, or and become a standard for students to be able to have other school districts looking at the potential of how we can help children modulate their own behavior?
I obviously think there is totally possible. I always go back to what my dad says: if you put a man on the moon, you can figure this out, right? But brain's bigger than mine, and people who can develop policy, but I can easily identify the issues. I don't know what the solutions are, because we often get in our own way when we're trying to help children. And unfortunately, in big public policies, children are always the last to be considered. Anything that's going to be helping children, whether it is increasing teachers' wages so that they can, be able to be great teachers and encourage more people to go into early childhood education, to the health of children. If you're looking at how society reimburses those who care for children, we're at the bottom of the totem pole. And we really do this because we love kids, and we love, to educate the next generation and make them healthy and be able to, just further society. I wish I could take my magic wand and fix it, but it's definitely, can definitely be done.
I don't know, maybe school boards asking more physicians to be on the school boards or psychiatrists and pediatricians to be able to give some greater understanding, psychologist, mind, body therapist who can offer some other tools. I'm a big believer in other tools for anxiety, and many of children I know have been diagnosed with ADHD when it's anxiety, and having other tools for them to use to be able to focus in.
Right.
And then there are other factors involved, whether it's bullying in the school, right? Or family situations. Families are, it's a tough situation for families in raising children now. In regard to, I think it's always been, it's not necessarily, but it's more even so now because most mothers and fathers are working and out of the house.
Right. I think there is kind of a collapse of how society works where, older generations, there was a lot of play involved. There was a lot of freedom and autonomy in young children. And you can see that in other countries where children have a little bit more freedom within society and they're respected within the society. And I think there's a lot of fear in American society if something might happen to a child because bad things happen. And so we're keeping children indoors more. And I think one of the biggest issues is the ready implementation of here's an iPhone, here's an iPad, here is a screen, entertain yourself in this virtual world because it's safe inside the house. And the problem is that screen in that virtual world is not safe. It might be safe from, things that a lot of parents are afraid of, which is, kidnapping or things like that. But the mind is ending up being stunted and hijacked by living in a virtual world.
Sure.
And I think that's probably, if I were to pick one issue, that's the one that I'll die on that hill.
I would have to agree with you there. And it's becoming really problematic, and there's a whole nother host of things that will come from that. And there is video gaming addiction that's really, really. I don't know if you see it in the teens and
more in boys than in girls,
right.
And pornography. The boys are getting younger and younger, becoming addicted to pornography
because of the screen.
Because it's private.
Right. So, what is the greatest? What is the most that you see in the ages of from toddler to a teen? What is it that you see mostly with children that you have intervene on, and what is it that your intervention could entail depending on what's going on?
Yes, very broad question. So I guess by ages, you look at in infants and toddlers some sort of dysregulation, right? What might have been termed, quote unquote, like a colicky baby. A baby is difficult to soothe, right? To toddlers who are what a lot of people call the terrible twos or the three-nagers, right? That they are oppositional. But really, I think what we all need to learn as people who are looking at children and being with children is that there's no such thing as a bad kid. They just are unable to regulate. And giving the parents the tools of what is normal developmentally, what are the behaviors that happen when this is normal, and when to worry. Right. Because it's very easy to stick a label on somebody and then, continue on with that label. Just like you mentioned earlier, that a child who might be 5 or 6 will be having this impulsivity and this difficulty focusing and inability to sit in their seat. When they're 11 or 12, it ends up being anxiety because now they have the words and the insight to be able to explain what's going on. They've been treated, for example, for this presumed attention deficit disorder, having been mislabeled as a young child. So I think a lot of understanding what's normal. Everybody's brain develops at a different pace. Everybody's brain, there are different functions of the brain that develop at different stages. So somebody might be able to be very socially aware and be able to have very good social connection, but might not be able to regulate their fight or flight, for example, like internally. So, everything goes at their own pace, and it's not a uniform maturation of emotions and regulation and everything. So knowing that it is completely normal for a 5 and 6 year old child to be popping out of their seat and walking around the classroom because they have not yet formed that inhibition. They know that they're not supposed to stand up during math class, for example, but they can't help themselves because that part of the brain hasn't been formed yet. And so they have this idea of, like, I know what I'm not supposed to do. Oops, I did it anyway. And now I'm going to be in trouble. I must be bad.
Right.
And then there's a lot of shame that happens with that. And then they carry that forward. So knowing what's normal, having, a tribe around, a village around this child that supports them as they mature, and being able to give that child the tools that they need in order to thrive.
Sure. Talking about tribe, that's the other thing that, so many families are not living in the same area, so there isn't an extended family to help provide that tribe for that child or for that family.
But you can make your own.
Right. Friends
right? And I think it's wonderful, especially if it's multi-generational, that you have, you incorporate the lonely widow that lives down the street who is probably also separated from her tribe.
Right.
And, I remember as a child, my parents would send me to the neighbors just to go talk. And I would, bring some baked goods or maybe a deck of cards and, talk. And it was great for me because I got to ask them all the questions I couldn't ask my grandparents. Like, what did you do in the war? Things like that.
That's funny. That's so true, because families don't want to have those questions, but outsiders can, are excused to come up with those questions. It would be really great to have a senior. They've tried this in some ways, in some places where there's a preschool and a senior center together, and there's interaction with that. Same with animals and dogs and pets, and to have that interaction to have
it helps
livelihood.
Both parties. I know they're doing it a lot in countries like Japan and South Korea, where they have one center where you have both preschool and nursing home type retirement centers, and both cohorts, the little ones in diapers, and then the elderly also all benefit.
Sure.
Yeah.
So I'm going to go into the teens. And it makes
my favorite. I love
I'm going
teenagers.
to actually start at the age of 12, because there's so many of our clients that they may be in their 40s, 50s, 60s, and their history of alcohol use disorder started at the age of 12.
Or younger in some cases.
In some cases, yes. So what do you see now in your practice?
Well, what I see is if there's a family history, there's a reason for me to screen earlier. Asking about recreational use, and then asking what we call the craft questionnaire, where we ask, do you ever, how many drinks do you have a day, a week? Do you ever feel like you need an eye-opener one? Has it ever gotten you in trouble? Have you ever suffered any consequences of being in trouble? And do you continue to do still the same behaviors? So getting a good both family history and personal history, and that all starts with rapport. If there's no trust between the patient, the family, and the pediatrician, a lot of these things will go undetected, because there is that element of social shame that goes with addiction, and a lot of people feel embarrassed to talk about it. So if there is that freedom to be able to have an open discussion with both generations, the teen and the parent, and say, listen, sometimes, genetics do play a role here. And understanding what is happening in an adolescent brain, and having that child understand that, their prefrontal cortex has not been developed yet. That doesn't finish until the mid-20s. And the prefrontal cortex is the part of the brain that is responsible for judgment, for consequences, for thinking about what might happen farther into the future, which is why teens and adolescents are such risk takers,
Sure.
right? They are, they know cognitively that driving 100 miles an hour, on 95 is dangerous, but it doesn't feel dangerous at the time, and they don't really see that far enough into the future. So there's a lot of risky behavior that happens. The other thing that I like to talk about with my patients is the concept of pruning. So the pediatric brain grows very, very rapidly. And there is a lot of maturation in both the gray matter and the white matter of the brain. The gray matter is what is kind of like the stuff that you're learning. And the white matter is then making those connections and wiring everything together so that, you have this behavior that then has like a smoothness to it after a while because you're, for example, playing the violin, right?
Mm-hmm.
In the beginning, you kind of take a while to put your hand on the, on the chords.
The first violin player is
exactly, or how to hold your shoulder and how to, angle the bow, and then after a while, it becomes smoother and smoother and smoother, and that's the white matter. That's the myelination. That's the wiring that gets, cemented better, for lack of a better word. And in adolescence, you have what's called a big pruning of connections in your brain that you're no longer using. And this is why we always say, learn a language when you're young, learn an instrument when you're young, because as you get older and you don't use it, then you lose it. There's a saying that neurons that wire together, fire together. So if you throw in at that really critical time in the development of an adolescent brain, you throw in something that might change the architecture of your brain, like alcohol or marijuana or opiates or any other drug that can change the way your brain's going to end up wiring and firing together, then you lose a lot of really useful things. So if somebody understands, even though they might not have the judgment yet, because that hasn't been developed yet, right? But if they have basic understanding, removing the shame from it and saying, this is what's running through our family. And if you start experimenting at this age, you're going to be at much greater risk. Right. I often use the analogy of smoking and asthma, right? So if you have a child who has a propensity to asthma, you're going to make sure that the air around them is clean and you're not going to smoke in front of them or near them. And you're going to really harp on the fact that if they start picking up cigarettes and breathing in, they're going to be worse in their lungs. That makes sense because, it's easier to understand. The brain is just so much more complex, right? But that's very similar to alcohol use in a family that has a family history of addiction. And then you throw that genetic predisposition, that environmental trigger, and then you can have lifelong issues afterwards. Right. So it's a lot of talking. It's a lot of, anticipatory guidance and talking with the family.
If the family does come to you and say, we've discovered this, this is what's going on, what do you advise them initially to do? And how does a family even start from there? If someone comes to you and say, I caught my son smoking marijuana, and I think he's drinking as well. What can we do to mitigate what's going on and able to help this child and erase the shame that may be going on with this?
So communication is key, right? Being able to understand that by the time the parent finds something out, this has been going on for a while. They don't find out in the first moment, right? That child has probably already experimented outside the home and then has felt comfortable enough with being able to be in the home to be able to continue. And that goes for any behavior that we deem risky as adults when we look at adolescents, whether it's sexual behavior or if it's substance use abuse or even anxiety, depression, and mental health issues that might be more inward facing, that by the time the parent catches wind of it, action needs to happen immediately because that is the tip of the iceberg. There's a whole other rest of the iceberg. And know that there, it's going to be a multi-discipline approach. So you're going to have support for the family, the parents, support for the siblings, support for the patient, and know that, there are people out there that can help you. And start now, because wallowing in denial is not going to have that kid get better any faster.
Denial is a river of, what is it called? A river.
Denial in a river in Egypt.
Right. So many times we have families that come to us and they're like so distraught. It's crisis that they're afraid of their adolescent. They're afraid of the behaviors that have been displayed, potentially violence from the adolescent, and also afraid potentially of them taking their life. And so they do everything which is counterproductive, but they think that just by holding on tight is going to help this person, but it just kind of explodes.
Right.
Have you seen any?
Oh, of course. Have I seen it? Have I lived it? Absolutely.
Yes.
Absolutely. Because there is that innate fear as from a parent to lose a child. And you would do anything to protect your child. And so the reaction that you would have is to hold them closer and tighter and kind of like turn inwards. And the opposite needs to happen. You need to find those who can help you. Even if it's your degree, your vocation, your job is in this.
You have to be objective.
You have to be the parent first and reach out to those who can help your child.
Right. It has to be a party that's objective. You cannot be objective as a parent.
Nope.
No matter what, because it taints you.
Yeah.
And there's so many. Also, I have to say the same thing is we will get maybe physicians, families who are physicians or and they have done this and this and this, and they are so entrenched in, well, I have the answer, so why would you have anything else? But again,
it's very humbling.
Taking that and giving it over to someone else to be able to help your family and let go.
Yeah. There's an aspect of surrender there.
Sure.
And then know that your role as a parent is to be the parent, and you can leave the therapy or the clinical role, like put that on the back burner, because you can't do both. You can't do both. And their child needs the parent at that moment.
Absolutely.
Yeah.
And tell us about where you're practicing. You're in Palm Beach County, but exactly where you are, where people can find you. Yeah. And I heard the other day when I met you that you do some house calls as well. I
do. So you want to get something done, you give it to a busy woman, right?
Yes.
After about 20 years of practicing general pediatrics in the Boca Raton area, I have opened a concierge pediatric practice. My office is in West Palm. And I see children in the home as well. So it's an annual membership type model where they have access to me 24/7, which is why I just silenced my phone so we wouldn't get interrupted during this conversation. So I do that as it's a wonderful way to practice medicine. It's a wonderful way to be of service to families because I have a lot more time to be able to dedicate. And I also look at things a lot more holistically because I'm able to step back and look at not only the child, but the family and how the family works. And going into the home is a very special thing because you get to see all of those that care for that child, whether it's a babysitter or a grandparent or siblings or, it's really, really special. And being able to practice medicine in real time, as opposed to, if your child's having a mental health crisis, then you call the pediatrician. They say, well, we don't have an appointment for another 10 days. And then you get there and you only have 15 minutes. And, it's very stressful, and it's very difficult to practice medicine that way. And just like we mentioned earlier about the education system being flawed, the healthcare system is quite broken. So I've been able to step away from that system and practice medicine in a way that's very satisfying to everybody. And I also do consulting work for the Children's Center for Anxiety and Related Disorders in Delray, which is wonderful, where families who may have been evaluated there for diagnoses or maybe are in counseling there, either the parent or the child, then would like to have like a pediatric, more of a global view of what's going on, whether that looks like we're going to be focusing more on the pillars of health, like, sleep, which is so important, or nutrition, or play, or, or organic things. For example, what does the blood look like? Is there enough vitamins and minerals that's supporting all of these important things? What does the gut look like, right? Because so many of our neurotransmitters, our serotonin and dopamine and epinephrine and norepinephrine, are actually being formed in the gut. And if we have a child who has a very limited diet, or maybe has what we call a dysbiosis, where the gut flora is not healthy, they're not going to be able to produce the neurotransmitters needed. And so if we can peel back the onion, as opposed to throwing a drug on it, and there are kids who do need medicine. And, I'm very comfortable doing that as well. But wouldn't we all rather make sure that the foundation is as healthy as it can be before we turn to pharmaceuticals?
Absolutely.
Yeah.
So there are so many concierge physicians in this area for the older adults.
Yes.
But as a pediatrician, are you the first one in this area as a concierge?
I am not. There has been one in Palm Beach Gardens. She's been around for about 20 years.
Oh, wow.
She's like the mother of all of us, newbie concierge pediatricians. Yeah. And it's becoming more popular because the demand is there. I think as parents of children who might have chronic illness, or even children who are healthy but they have a busy, life, that there is a need to not sit in a waiting room and be able to see the same physician every single time, and not have those big practices with multiple, physicians. And there's a place for that as well, right? Because there's a lot of ease and access, and things are covered by insurance. But for those who are looking for a different way, there are all these different models out there.
Well, there is so much support that could be and needs to be provided to parents as children grow, from 0 to 18, that you go for a wellness check or a sick check. That's about it. But the other things that you described, it's like fine-tuning a child's brain and body to be their utmost in their life. And we get so busy as humans and as parents that for parents to have that, I would think that it would be such a relief to know that someone else is really helping.
Yeah, you can't put a price on it.
No.
You cannot put a price on it. I actually have one family that I see, they have several children, and she tells her friends that I'm the third parent in the family, because, for these big decisions and little decisions and guidance and everything, I'm just like the little, Jiminy Cricket who's sitting on the shoulder saying.
Well, it's so valuable for their growth and development and for their education, because they need that healthy growth and development, and be able to really feel that they can talk to someone privately about anything that may be coming up.
Right.
So.
And a lot of people think they can turn to social media or the internet to get, or even worse, artificial intelligence to get these answers. And then you have this information overload and this misinformation and disinformation, and it's really hard to know what to trust out there. I don't Google how to fix my carburetor. because I know what that word is, but it's all about that I know. And I'm sure if I Googled it, I will know what to do. But that's not going to help me if there's a problem with my fixing, or it doesn't help me understand exactly what the role of a carburetor is, or how to detect if, there's going to be some problem with it. So I leave that to the experts. And I think it's very easy to doom scroll at 3:00 in the morning when your baby's not sleeping, how to fix these things. And you're going to have 10 people giving you 15 opinions, and you're worse off than you were before you started doom scrolling.
Yeah. I mean, there's so much information that is out there, that good, bad, and whatever, indifferent, and be able to just be at peace to have that. And I was saying this recently, that people will pay for a contractor, talking about, fixing your own carburetor, but people will pay for a contractor, they'll pay for a finance person, a lawyer for a lawsuit. But when it comes to their health, they minimize and try to have everything covered under insurance. And that's not even, today, it's not possible to do that.
Right.
It's, as you say, the healthcare is broken, and we need to look at other ways to have a healthier way to do it.
Right. And oftentimes it makes sense. I mean, I have some children in my practice who are very ill, and the membership fee that is, the annual membership is less than one ER visit. And, after the deductible and the co-deductible and the copay and then all of that.
Sure.
And if I can keep the kid out of the ER, then it's worth its weight in gold. So it's not just the financial part, but the trauma for a child to go to the emergency room and get blood work done, or the wait, or you go into the emergency room with one infectious disease and you come out with 3. So.
Right. And you have, it is trauma just going to the hospital.
Yes.
For a child, for anyone, actually, it's not a good thing anymore.
Right.
Well, thank you so much for
wonderful.
Coming on.
Absolutely.
I really appreciate you having this guidance for families, and for everyone that knows, we do intervention case management coaching. So Feinberg Consulting can get referrals from anywhere, including pediatricians.
Yes. And I can also be found, my website is, my practice name is Moore Healthy Kids. My last name is Moore with 2 O's. So my website is morehealthykids.com. Yeah.
That's great. Thank you so much.
Thanks.
Thank you for joining the conversation today. If you are seeking help for yourself or a loved one, please reach out to our Feinberg Consulting team at 248-538-5425. That's 248-538-5425, and check out our website at feinbergcare.com. I'm grateful for our guests and all who have joined us today. Make sure you follow us on Apple, Spotify, or anywhere you listen to podcasts.